Hello, I'm Dr. T. Welcome back to Diabetic Foot Files. So, imagine stepping on something, like something sharp, on your barefoot. That's why I don't like anybody walking around barefoot. But nice sharp stab, and it's a piece of glass. Now, imagine a clinician suturing that wound without removing the glass. What do you think is going to happen to the body when that happens? Why is this a disaster waiting to unfold? Because I had a patient telling me, I was like, "Oh, so why don't you go to the hospital?" Because he has a little bit of phobia. The patient told me that a few years ago, when he was much younger, stepped on glass and they sutured the glass in him. Yes, he had a wound with glass in it, and they sutured and left glass in his body, in his foot, pretty much. And yeah, it got infected. It was a whole thing, and I was just like, yep, I understand why you have dystophobia because you would think that, again, common sense would be common, right? Because the patient said they stepped on the glass. They believe they stepped on the glass. And I don't understand why they sutured it. Okay. But it's a puncture wound. It contains glass and you shouldn't close it. Okay. It's improperly closed. It's a foreign body. And, foreign body injuries are quite common in feet. That's why we don't like you walking around barefoot, especially with diabetics who have diabetic neuropathy. We see a lot of patients, they end up getting really bad foot infections from stepping on a foreign body and not knowing that it's there. They end up finding out usually when the foot blows up with infection, swollen purulent drainage, things like that. So that's why we always ask diabetics to check their feet every single day. I think you'll be surprised how more common than not that diabetics step on foreign objects. Okay. We all step on foreign things. Okay. Like we could feel like the slightest little piece of grain of sand, right? I can feel when there's sand on the floor like just my regular hardwood floor. So imagine not being able to feel that, okay? So yeah, the first mistake that the doctors did were suturing over a foreign object, which I still can't wrap my head around it, but I understand where the patient has this distrust in the healthcare system now because, yeah, he could have probably even lost his foot from that. Okay. Because something like that just creates infection, chronic inflammation, delayed healing. And as you know, a lot of times with foreign bodies, our bodies like tries to push out the foreign body. Our bodies are amazing. So today we're going to go through the chemistry of glass and wound physiology, detection, labs, and management. But all of this just comes down to being given doing your diligence to a patient. Just taking your time, asking about the history, doing a proper physical, getting the proper imaging, and not trying to rush the healing process because I still can't wrap my head around why they would suture it. And like I said, for patients, you have to advocate for yourself, okay? Because you don't know, oh, are they supposed to suture the glass in my foot? I don't know, right? But I guess the patient trusted the doctor well, that they knew that what they were doing, right? So, what is glass and how it reacts to the body? So, the chemistry of glass is silica. So, SiO2. That's the chemistry structure of it, the chemical structure. And with additives like sodium oxide and calcium oxide, it changes properties. It is inert. So, inert means it doesn't dissolve easily in blood or tissue. So broken glass usually has jagged edges, irregular fragments, sharp, and these can cause mechanical tissue damage. So glass in the body, it's non-biodegradable. Okay, so your body won't be able to degrade it. Okay, it can act as a nidus for infection, and it can trigger a foreign body reaction. So the macrophages and the giant cells around your body might try to surround it and wall it off from your body. See how amazing the body is? So the physiology of it, most likely you might have acute pain, but if you have neuropathy, that most likely will be mass, bleeding, most likely swelling, inflammation, erythema, warmth. Sometimes what happens is it makes a granuloma formation and then possible delayed healing. And in diabetics, we already know with the increased blood sugar, there is impaired neutrophil function. And then with the advanced glycation end products, as well as calcifications in the arteries that can cause more poor perfusion. So for diabetics, if they step on a foreign body and it is retained in that part of their body, they have a way higher risk of infection, osteomyelitis, and chronic ulceration. So, why is suturing over glass wrong? I mean, to be honest, like I said, I would think this would be common sense, but somebody actually did this to the patient, a healthcare provider who did this. And, this isn't about shaming, but I would think that this is something you know not to do. Okay? I think this is something we know not to do, not to close a wound with glass and trap it as a foreign body. I know that sometimes they leave bullets or certain things in the body, but I don't think you should leave glass in the body, in my opinion, okay? Everybody has to each his own, but that's my thing. I'm very black and white, absolute right or absolute wrong. So I feel like it's absolute wrong to suture over a puncture wound of glass and leaving the glass in the body. Okay, so if somebody contests that, okay, then I have nothing else to say when it comes to that. But closing a wound with glass causes it's a foreign body, okay? And that leads to persistent pain, swelling, infection, whether it's superficial or deep, delayed healing, abscess formation, and risk of osteomyelitis. Oh, on a side note, a lot of times when patients step on foreign bodies, they try to remove it themselves. I'm not a fan of that. I do recommend go to the ER immediately, stay off of the foot so that it doesn't move deeper into the different planes of tissue, or if it just gets into a deep space in your foot where you have to go to the OR and they have to fully anesthetize your foot. So, depending on the situation, but you should never try to move it by yourself, in my opinion. Okay? You should go to the ER immediately. Okay, I'll call 911 so that you can get it taken out immediately, sterile, and that they can flush it out properly and put you on the right antibiotics for puncture wounds. And like I said, when you're a diabetic and you get a puncture wound, I mean, I've had patients who had puncture wounds, right? And they went to the ER urgent care and then they didn't even get dispensed antibiotics. And then even though the foreign body is removed, they come back within a week having this crazy infection. And then they come to the podiatrist and I asked, did they give you any antibiotics after them removing the puncture wound? And they say no. And I'm like, I'm confused by that. Why not give the patient antibiotics after a puncture wound, a dirty puncture wound? I don't understand that either. So, the physiology of it, what can cause and when you step on glass, you can cause pressure necrosis. So glass presses against the tissue and that can lead to ischemia and tissue death. Next is the inflammatory cascade. So trapped glass causes an ongoing immune activation, which leads to chronic inflammation. So, an example is a patient with a foot laceration sutured the foot without removing the glass, right? We do not want that. I think it's wrong. Don't do it, okay? Remove the glass. And to be honest, sometimes you might I think mostly I would leave it open or you could suture it if you know for sure you've removed all the glass. If you're not sure, you could get a CT, right? So if you sutured it, the foot laceration without removing the glass, swelling, redness, purulent drainage, most likely the patient will require surgical removal of the glass and antibiotics. So, what are the clinical detections for glass in a wound? So, history and physical, mechanical mechanism of injury. We always have to ask that. Did they step on it? Broken window, things like that. Persistent pain despite wound closure. Palpable hard fragments underneath the skin, possibly if it's superficial enough. Swelling, erythema, and draining sinus. X-ray glass is radio opaque. So that means depending on the type, sometimes some glass is missed depending on the type of glass. Ultrasound is quite useful for superficial glass fragments. It shows as a hyperechoic, so it's going to look bright on a ultrasound, so it's gonna be a hyperechoic object with shadowing. CT, love me a CT. CT is the gold standard for deep or multiple fragments of foreign body in your body, so I love me a CT. So, when it comes to exploration, most likely you're gonna have to do that. Exploration under local anesthesia, gentle probing of the wound edges, avoid blind suturing. That's what it's pretty much called. And irrigation with saline. I like to do irrigation with saline and iodine. solution, yummy, like, because it helps it's a good antiseptic, okay? So why not, okay? To help remove small fragments. So what happens to the body when glass stays in the body, okay? So when it comes to the skin and the tissue effect, laceration edges cannot approximate well because it's going to be chronic inflammation because the body's trying to push it out. So there's going to be a chronic ulcer formation. Then there's going to be necrosis around the glass due to the pressure, and then a form body granuloma can possibly form, which is a firm nodule around the skin. Complications of this possibly, but most likely, infections, Staph aureus, streptococcus, or anaerobes, abscess formation, chronic sinus tracts, a potential for a bone infection, most likely as time goes by, if you leave the foreign body in there, especially in diabetics. Diabetics consideration, you always have to remember that diabetics have the higher risk of neuropathy, so that may mask the pain. That's why I always tell people just first of all, take patients' pain seriously. And if they are neuropathic, that's even more reason to investigate more to make sure that you don't miss anything, okay? Because they're depending on you. They're depending on us, okay? Reduce immune function as a diabetic because that increases their risk of infection because of the dysfunctional immune system. And then impaired wound healing, okay? So that would cause increased risk of amputation, right? So the whole thing about this is for us to prevent amputation. So immediate management of glass in your body, foreign body, let's say it's just a foot, do not suture over the glass. Step number 1, do not suture over the glass. Step number 2, remove the foreign body. Adequate anesthesia, exploration and irrigation. Use sterile technique and magnification if needed. Sometimes people even use the C-arm. Next is irrigation. Copious saline to remove small particles. Sometimes people use like a Versachat, depending, mostly for like bad infection, but you can use it or pulse lavage. Pulse lavage. I love me an antiseptic irrigation with iodine, povidone iodine. Works very well. Wound closure. Usually things like this is left open. If it's contaminated, I think we all learn about how to treat open wounds, right? That have foreign body and debris in it. Delayed primary closure after infection risk is reduced because you want to make sure that all the infection is gone. You do not want to suture a wound closed with the infection still there. And then antibiotics, empiric coverage for skin flora like staph or strep, and consider deep coverage for foot or bone, right? But there are some main ones when it comes to puncture wounds, right? They always say puncture wounds, you think pseudo, right? PP, right? Puncture, pseudo, think. Okay, so labs and workup. Baseline, you're gonna get the CBC because you want to rule out leukocytosis. You don't want the white blood cell count to rise because that will show that is consistent with infection most likely. You get your CRP or your ESR, which are your inflammatory markers. Blood glucose, we have to see how well the patient's glucose is managed. The higher, the worse, the more likely delay in healing and higher risk of infection. And blood cultures if there are systemic signs. And like we said, imaging, some types of glass can be seen on x-rays, but when it comes to gold standard, you should just get a CT. That's easier. Ultrasound, remember ultrasound, glass is going to be hyper echoic, so it's going to be bright with shadowing, okay? And MRI, you can get an MRI if you suspect osteomyelitis. Follow up, repeat inflammatory markers to monitor the response to see if that CRP or ESR goes down. More CRP. I would more look at the CRP. And wound cultures if infection develops, okay? So what to do if you just suspect that glass is left in the patient's foot? Stop using the wound. Do not cover it with a tight dressing without full assessment. Seek proper medical evaluation. Avoid walking barefoot. Always do that, okay? Remember 60-second rule. Just check the bottom of your feet every day, no matter what. Even people without neuropathy, even people without diabetes, you should check your feet every day at the bottom of your feet every day. Check your feet every day, okay? Because then you'll notice if there's any subtle changes because it's better to prevent and treat the early signs than to deal with the late signs later, right? Bring a history of the incident to the provider and imaging before attempting removal at home. Please don't do that. Don't remove it at home. Don't try to. A lot. I know a lot of patients do. Sometimes it's just a normal response to like pull it out. I understand that, but we all just just try to get to the ER immediately. Okay, self-care tips: do not attempt any deep probing at home. It's a very unsterile thing to do, and you're just putting more infection in there. You can clean a superficial wound with soap and water and observe, you know, but the doctor's supposed to take care of all that, okay? So when it comes to advanced physiology of glass, a foreign body glass in your body, so glass triggers the macrophages, and then the macrophages turn to the multinucleated giant cells. The fibroblast actually tries to wall off the piece of glass, and that's how you create that granuloma formation. What are the cytokines that happen through this chronic inflammation? TNF alpha, IL-1, and IL-6. Those three, you're just gonna have to know by heart. And then tissue fibrosis around the skin, let's say around skin, forgive me, around the glass, like scar tissue formation, and that will possibly limit the mobility. So when it comes to a diabetic stepping on glass, hyperglycemia, like we said, impairs the neutrophils. It also impairs the neutrophils chemotaxis, which chemotaxis, the neutrophils actually moving to the site of infection, okay? Also, there's going to be a reduced growth factor activity, which slows angiogenesis. What do we need angiogenesis for? To make new blood vessels so that we can heal properly and make skin. And then there is decreased collagen deposition, okay? And that causes the skin to be more fragile. So we have to keep that in mind. But like I said, prevention is better than cure. So what we do, always check wounds for foreign bodies. And that's another thing. On a side note, do not walk around barefoot when you wound close. Do not walk around barefoot, even if you have a tiny little baby wound, because so much things can go into the wound. Like, remember we talked about leaving your foot wound open? Like, I've had patients get their wounds infected because they said they wanted to air it out. Can you not do that? Don't air it out. Protect the area. This is this is the red cone area. We gotta keep this area covered, protected from an infection, and make sure that it's a good environment for skin to actually form so that it can actually have a barrier between your body and the outside world, okay? For diabetics, like we said, inspect your feet every day, especially after trauma. I mean, as a diabetic, any sign of infection, abnormality when you flip, please go see your podiatrist or go to the ER immediately. Do not let anybody downplay your symptoms. Do not feel like you're being too much or you're taking it way too seriously. No, as a diabetic, you should, even the smallest thing or abnormality, you should seek medical attention to see if it's anything serious because it can blow up so fast. So and we've seen so many patients like that. And, I do understand where patients are coming from. A lot of people do downplay people's symptoms because they're not feeling it for you or they're just rushing the patient, and I don't like that. So, like I said, to all patients, advocate for yourself, okay? And educate yourself. Never suture a wound if there's a chance that something is inside. So if you notice the person beginning to suture your wound and you're like, hold up, are you sure nothing's inside? And they say, oh, there's nothing on x-ray. You can say, feel like something inside, and can you get a CT or ultrasound to make sure? I've seen that happen to patients in the past. They said that there's nothing on x-ray, and then they come back within a week. I've seen it, not on my behalf, but I've seen people in the past do this. And person comes back and the foot is completely swollen and infected. Then they do a CT or MRI and they say there is the foreign body in there. So it looks bad when that happens, okay? And then proper foot gear, like we said, no walking barefoot. So in a quick summary of this episode, glass is a very dangerous inert object for any wound. Do not close over it. Remove it. Get it removed medically. Imaging and careful removal saves tissue and prevents infection. And like we always know, as diabetics, we have to take special precautions and know that there are higher risks for complications like that. Okay. There are other different foreign bodies like wood, metal, and other things that behave differently inside the body. Just like I said, there are some people who have the bullet left in them, right? And I remember one time the person, a relative passed away, and the person had the bullet in their body for like maybe 20 years. And they didn't get it till after the authorities, I guess, didn't get it till after the person passed away. So I thought that was quite interesting that I didn't know that person had maybe I think they had multiple bullets living inside of them for a while, you know? But that's a whole different story when they leave bullets inside of you, okay? So we'll cover that. But this is Diabetic with Files. I hope this episode was helpful. It's pretty quick because I think I got the flu or a little cold again. So take care of your feet because they take care of you. This is Dr. G.